Hi everyone, it is now week 7 and we are looking at culture more than ethnicity, so I wanted to highlight some of the learning opportunities you have in this week's content. Um, as you start reviewing the content, please um, take the time to look at some of the other um, YouTube offerings that are in the lesson plan this week. And I want to call your attention, first of all, to two of them. One of them is called The History of the Deaf Culture and American Sign Language. And then there's a second one, too, with a similar title, American Sign Language History and the Deaf Culture. And this will give you some background as you move through the content. Um, there are two additional ones too that I would encourage you to look at. Their presentations. One of them is a hearing loss simulation that will give you a good idea of what it's like to lose your hearing over time. And then a very sad one about discrimination against service dogs called No Dogs Allowed. So please take the time to look at those. Finally, there is uh, an audio PowerPoint presentation that Dr. Levy uh, organized, and she is our instructor for that content and talks about what it's been like to have a hearing loss. And again, she is a nurse educator that is deaf. So she has struggled with discrimination in a variety of circumstances. And again, I think has given us a real valid perspective, again, um, thinking about individuals in our society that have this kind of um, physical condition that they deal with. So take a look at the content, and it is very inspiring. And I hope you have, that you feel the same way as you finish. The other piece that I want to point out, I'm going to upload a PowerPoint presentation just for you to view, and it again moves back to looking at working with cultural groups. And I think it's still important to think about both, again, looking at culture as Dr. Levy presents it more than ethnicity, because first of all, in her circumstance, we do deal with individuals with a whole variety of disabilities. And as nurses, we want to be sensitive to their needs. And again, in the community, this is something that we are going to, and in any healthcare facility, you will interact with people of all shapes and sizes and different qualities that they present. So you want to be sensitive to all of each of these individual needs and really try to accomplish, what they're seeking and provide for them. Um, I still do want to again highlight a few pieces about dealing with people from different cultural groups, because we as well our practice, the individuals that we care for come from all walks of life and backgrounds, and it's always important just to kind of pull that sensitivity forward so that you can continue to care for them in a caring manner that they deserve. Um, it's interesting, when I was looking at this content, we have to remember that when community health nursing started, if you think about that history presentation, um, in 1893, as the public health nurses started their practice in New York City, and as we think about the Lillian Wald and her colleagues that worked at the Henry Street Settlement House, they were dealing with immigrants that had come from mostly from Europe. So this isn't anything new. We have cared for people of different cultural groups throughout our professional history. So um, it is certainly something that has been around for a long time. A few other things that I thought were important to include, because I have a fond um, piece in my heart for the Hmong people. I worked really in a number of service areas and provided care for them when I worked as a public health nurse in Sheboygan County, and they really are such a special group of people that have so many interesting qualities. And it, again, thinking about their traditions and values is something that will help you as nurses provide excellent care for them. Um, uh, the first part of the cultural presentation, the PowerPoint, looks at some of the laws that have been passed, and there is one in particular that I want to highlight, and this is the Refugee Act of 1980. This actually was based on the United Nations definition of refugees and provided a uniform procedure for bringing these people into the United States. And I bring up the Hmong because they certainly came into our country under this kind of legislation. This provides for people entry to our country for religious and political freedom and following through with economic opportunities. And this included people that came from Cuba, Vietnam, Laos, which is where our Hmong people are from, Cambodia, and then a little bit later the Russian Jews. But it allows people that have been tortured or face the prospect of being tortured. They've lost families, they've lived in refugee camps, and pretty much have lost all their possessions as they leave their homeland and come and seek shelter in the United States. The interesting thing about them is that as they are admitted, they're outside the usual quota restrictions that our country has set up to allow immigrants in. And again, they receive a variety of benefits right from the start because of their special classification. So I think that's important to understand that again, when I think about the Hmong, they actually worked with the CIA during the Vietnam War and fought against the communists in kind of an underground method. And then when the country fell and the communists took over, they started killing and persecuting them. And so they were uprooted from their villages and homeland and needed to flee to refugee camps and then again to countries in Eastern Europe such as France, and then eventually many of them have come to the United States. And Wisconsin is one of the stronghold areas. And it has to do with the churches that brought them here in the very beginning. So there were many Christian churches that organized their transport from the refugee camps into our country. Um, as you look through the PowerPoint, again, just use it to strengthen and what you already know about working with different cultural groups. I think this is something that a lot of you have had some experience with, and hopefully in your other nursing programs and your BSN completion program have come across concepts that deal with this and how important it is. The one other area that two things that I want to talk about as you move through that PowerPoint a little further on, to highlight that cultural competence is a very important agenda item for Healthy People 2020. And again, it really is promoting that nurses need to have a culturally congruent practice, that, again, these um, attitudes and policies that are established in all our healthcare facilities allow the nurse to work effectively in cross-cultural situations. This is going to promote healing and certainly increase satisfaction among the individuals that we care for. We want to have respect for the clients from other cultures and really learn to appreciate their diversity. I think that was the biggest benefit that I had working with many, many Hmong individuals, is that I really learned a lot about their culture and learned to enjoy their differences and understand their traditions and really appreciate some of the values that they hold dear to their heart. We need to acknowledge that there are fundamental differences between us, but still respect, again, and take into consideration what's important to them. And a couple of things to highlight. Always to think about the differences in our diets. And again, food is always such an important piece in everyone's life, and certainly with different cultural groups, there does seem to be certain foods that are part of their usual um, diet on a day-to-day basis. How they express pain is another real important thing to think about. You're going to see differences depending on cultural groups that you work with. Um, how they, what are their traditions or practices during, as an individual in their family or clan could be, is when we speak of the Hmong, when there is a death or someone is dying. And I always think that even as people from different cultural groups become more westernized and they start to pick up practices that are more thought of as connected to the Western culture. When there is a birth in the family or a death, this is when people will go back and use their traditions that they um, have learned throughout their lifetime. There also are issues with modesty, eye contact, closeness, and touching. So those are things to think about and really make sure that you are keeping those in mind as you work with these individuals in your clinical practice. It's very important too, and if you look towards the end, the second to the last PowerPoint, this is important considerations when conducting a cultural assessment. And again, be aware of your environment, make sure that it is welcoming and it encourages a caring atmosphere. Know about the community social organizations. So then again, and I've always said this as I've been a nurse educator, if you are working with other cultural groups in your community as a nurse, you need to understand them. So learn as much as you can. If these are people that you're seeing on a fairly regular or even an intermittent basis as you work in your area of expertise. Know the specific areas of focus that you'll be dealing with. Um, Come up with a game plan for gathering information. And again, you want to talk to people about things like, what does this illness mean to them? What do they call it? When did it start? What did they think caused it? What works to alleviate symptoms? Um, how long do they think it will last? Is it serious? And what have they used so far? Have they used non-traditional methods, other healers? Many of, especially in our Hmong culture, they will seek out cultural techniques and traditions first and variety of healers before they will go to a Western practitioner. Um, these are ways to, again, bridge the gap as it talks about. Know how to ask questions, and again, the variety that I just listed are important. Um, it, Learn from other healthcare professionals that have more experience. This is a very good source of information. Get in and out and about in the community and talk to formal and informal leaders in the cultural groups. Um, Always be aware that information that's given to you can be both objective and subjective. Don't make generalizations. And I think the 11th one is by far the most important. Be sincere, honest, and open and respectful. Um, and finally, just remember that thinking about health literacy, we have about 90 million Americans with low literacy skills. So we have to make sure that our approach and our level of conversation is one that they can understand and that they understand what our instructions are as far as healthcare goes. So I will upload that for you, and along with it, as I load this YouTube video, I'm going to put a connection to another short YouTube presentation on the Hmong culture, and it's called The Spirit Catches You and You Fall Down, and it really in pictures shows their struggles in Laos and as they moved into Thailand and the refugee camps, and then finally their settlement here in the United States. And the title comes from a book that was probably published about, I want to say, 10 years ago at least. And it documents the struggles of a family in California when interpreter services weren't mandated at the federal level. and they had a little girl that had epilepsy, and they had very poor English speaking skills. They had just come to the country, so there was a lot of difficulty with translation and all the confusion as she, in numerous occasions, wound up in the emergency department at the local hospital because she was having a seizure that was in an uncontrollable state. And just, again, the frightening history of how meds were prescribed over and over again in different amounts and different types and quantities, and their inability or their lack of understanding about how to provide the correct doses of medication to her and the effects it had on this child. And it's a wonderful book if you have time. I know you all are very busy, but it's a quick read, and it is just an excellent cultural experience to get you to think about how terrifying it must be for people that don't speak English to come into our healthcare system and seek services. In their case, as the interactions continued, they finally had a married couple of pediatricians that took over this child's care and insisted on being the ones called when she would come to the emergency department so that they could work with the family and get her stabilized. But it is a very interesting presentation, so I will upload those for you as well. So I think that's it. There are a set of questions again this week on culture, and it really does focus on the presentation on the deaf culture and, again, discrimination in many different aspects. Um, so it's important to watch the presentations that I highlighted in the beginning. That will help you answer those questions this week. And again, the agency assessment, if you need more time than May 30th is fine. Continue to work on your teaching module that is, again, to be given to your practicum site, either for education for their staff or for clients that they deal with. And we're, again, quickly moving to the end of our course. So I hope you're enjoying this content. And I will be getting feedback back to you for the nursing care plans, the community nursing care plans that you submitted. So I think I'm going to end this here, and please keep in touch if you need or have questions. Please let me know, and I'll see you again next week.